So liposuction basically involves removal of fat from a person's body by making minute cuts and using long cannulas to suck out the unwanted fat. Liposuction can be done at any part of the body except the scalp, and it benefits patients who are otherwise healthy. So an ideal patient is one who keeps himself fit, takes control of his diet, does some sort of exercise, and his body weight is maintained over the last 6 to 12 months. Liposuction is definitely not a procedure to remove or to cure obesity, because for obesity there are certain other surgeries. It is more of body contouring procedure whereby we can make the patient's shape better by doing liposuction at select parts of the body where there is stubborn fat. So bariatric surgery is basically done by a GI surgeon whereby they decrease the size of the stomach so that the person cannot eat beyond a certain limit, and if he or she tries to eat more, then there will be vomiting. Whereas plastic surgery or liposuction is a process whereby we remove the subcutaneous fat by the means of suction cannulas which are inserted through small ports or cuts made in the body. Liposuction works well for patients who maintain their weight constantly. If you maintain the weight, the results are there for you for life. But if you keep on gaining weight, the fat will deposit to some extent at the point where we have done the liposuction or at other places where the liposuction process has not been done. So the patients are able to walk home the same day if the lipoaspirate or the amount of liposuction is limited to 1 or 2 parts of the body. The patients can move around. They may be slightly sore at the areas where we have done the liposuction. Depending on the amount of fat that has been sucked out, the recovery is dependent upon that. So patients who undergo liposuction of 1 or 2 areas of less than 2 liters, they tend to do much better than patients who have got liposuction done at multiple sites and more than 3 to 4 liters of fat has been removed. The normal timeline is about 2 weeks for healing, but gradual improvement happens over time, but small aches and pains can stay for up to 4 to 6 weeks. See, the results are dependent upon the patient's habitus, body habitus, the skin elasticity, whether the patient is a smoker, whether the patient is taking care of his diet, exercise, and the other ancillary thing is that the patient has to wear pressure garments post liposuction. So if he adheres to this technique, these few things, then the results are very good, and most of the patients who undergo liposuctions are very happy with the results. The scarring which results from liposuction is basically through the ports through which we inject the small cannulas, but these cuts are less than 1 centimeter in size. So unless they are made on a prominent part of the body, these scars are not seen because they are hidden either in the undergarment area or around the umbilical area or in the axillary line.